What is the normal range for adult blood pressure? The answer is uh, the B, 120 by 80 mm of Hg. The normal blood pressure range from adult is 120 by 80 mm of Hg. This considered the standard for healthy adult. Then, what is the primary function of hemoglobin in the blood? To fight infection, to carry oxygen, to clot blood, to transport nutrients. The answer is to carry oxygen. Hemoglobin is a protein in RBC responsible for carrying from the lungs to rest of the body and returning carbon dioxide from the tissues to the lungs. Next question. What does PRN stands for in medical terms? As needed, daily, before meals, every hour. The answer is A, as needed. Down also you can see PRN stands for pro re nata, which is Latin phrase meaning as it indicates the medication treatment is given as needed. Then what is the main purpose of Glasgow Coma Scale? What is the main purpose of Glasgow Coma Scale? To measure pain level, to assess neurological function, to determine blood glucose level, to evaluate respiratory function. The answer is B, to assess neurological function. The Glasgow Coma Scale used to assess patient conscious level. Okay, the next question. Which of the following is a common symptom of hypoglycemia? Which of the following is a common symptom of hypoglycemia? Weight gain, bradycardia, tremors, hyperactivity. The answer is tremors. Hypoglycemia or low blood sugar causes symptoms like tremors, sweating, confusion, dizziness due to inadequate glucose supplies to the brain. Okay, next question. Next question. Sixth question. What is the term for inflammation of the liver? Hepatitis, nephritis, gastritis, dermatitis. Answer A, hepatitis. Hepatitis is nothing but inflammation of the liver, which can be caused by virus, alcohol use, toxins, medications, and certain medical conditions. Then seventh question. Which electrolyte imbalance is indicated by muscle weakness, cramps, and cardiac arrhythmias? Options are hypercalcemia, hypernatremia, hypokalemia, hyponatremia. Hyponatremia. Answer is C, hypokalemia. Hypokalemia or low potassium level can cause muscle weakness and cardiac arrhythmias due to potassium crucial role in muscle function and activity of the heart. Next question. What does BMI stands for? Option A, body mass index. Option B, blood mass index. Next, body measurement index, blood measurement index. The answer is body mass index. BMI stands on body mass index. It measures, the purpose of this BMI is to check the height and weight. and for estimating fat, and it helps in assessing whether person is underweight, normal weight or overweight. The next question, what is the primary function of kidneys? What is primary function of kidneys? To digest food, to produce hormones, to filter blood and produce urine, and to control movement. Answer is C, to filter blood and produce urine. The kidney has the capacity to filter waste products and excessive substances from the urine, and not only that, it helps to regulate the fluid balance in our body, electrolytes, and remove toxins also. The next question, what does ECG stands for? What does ECG stands for? Electrocardiogram, echocardiogram, electroencephalogram, electromyogram. The answer is A. Electrocardiogram, ECG, or we can also call EKG, records the electrical activity of the heart, used to assess heart problems, and not only that, can check the heart condition. Then next question, which type of diabetes is characterized by insulin resistance? Which type of diabetes is characterized by insulin resistance? Type 1 diabetes, type 2 diabetes, gestational diabetes, pre-diabetes. Answer is B. Type 2 diabetes characterized by insulin resistance. Nothing but there is no proper release of this insulin. So because of that, there is no conversion of glucose to glycogen. So it causes type 2 diabetes. Then next one, which medication is commonly used to manage hypertension? Which medication is commonly used to manage hypertension? Insulin, albuterol, lisinopril, metformin. C. Lisinopril. Lisinopril is an ACT inhibitor commonly used to treat high blood pressure, relaxing blood vessels, and not only that, it lowers blood pressure and improve blood flow also. ACE inhibitor. Okay, the next one, what is a medical term for high cholesterol levels in the blood? What is a medical term for high cholesterol level in blood? Hyperglycemia, hyperlipidemia, hypertension, hypoglycemia. The answer is hyperlipidemia. The medical term for this high cholesterol in the blood is hyperlipidemia, and it's include nothing but high cholesterol in blood, which can increase the risk of cardiovascular diseases also. And what is a normal range for fasting blood glucose level in adult? And can you give answer? 40 to 70 mg deciliter, 70 to 100 mg deciliter, 100 to 130 mg deciliter. Option D, 130 to 160 mg deciliter. The answer B, 70 to 100 mg deciliter. Okay, the normal range for fasting blood glucose level in adult is B, 70 to 100 mg deciliter. So above, if it is above, it indicates diabetic or pre-diabetic. The next question, which condition is characterized by chronic inflammation of the airways causing difficulty breathing? Which condition is characterized by chronic inflammation of airways causing difficulty breathing? Pneumonia, asthma, tuberculosis, bronchitis. The answer is B, asthma. Asthma is a chronic condition characterized by inflammation of the airways leading to wheezing, shortness of breath, SOB, and coughing. The next question, what is the primary function of platelets in the blood? What is the primary function of platelets in the blood? To fight infection, to carry oxygen, to clot blood, to transport hormones. The answer is C, to fight for infection. So platelets, or we can also small cell fragments in the blood, plays a crucial role for clotting. At the site of injury, stick together and form a clot. The next, what does the abbreviation SOB stands in medical terminology? So this is a easy question, I thought. What does the abbreviation SOB stands for in medical terminology? Shortness of breath, side of breath, short of breath, source of bleeding. The answer is A. Shortness of breath. SOB stands on shortness of breath. Common symptom of respiratory and cardiac conditions. It is a common symptom of respiratory and cardiac condition. The next question. Sorry. Okay, see. The next question. What is the main side effect of opioid analgesics? Opioid analgesics, painkillers. What is the main side effect of opioid analgesics? Hypertension, diarrhea, constipation, tachycardia. Tachycardia. Here you see the answer. Constipation. The answer is constipation. So why? Because the main side effect of this opioid analgesics is it shows the effect of the gastrointestinal tract, and not only that, slow down the bowel movement. So because of that, you can see the constipation side effect. The next one, which vitamin is essential for calcium absorption in the blood? Which vitamin is essential for calcium absorption in the blood? Vitamin A. This is also easy question. Vitamin A, vitamin B12, C, D. My answer is D. Okay, D. D is the essential for calcium absorption in intestine, and the function of calcium is to maintain healthy bones and teeth. Okay, the next question, what is the primary purpose of incentive spirometer? Incentive spirometer. To measure blood pressure? No. To administer medication? To encourage deep breathing? To monitor heart rate? The answer is to encourage deep breathing. Incentive spirometer is a device used to encourage the patient to breathe and for deep breathing, and not only it is also prevent the lung complications such as atelectasis. The next, which of the following is a common of left-sided heart failure? Which of the following is a common symptom of left-sided heart failure? Peripheral edema, jugular venous distension, pulmonary congestion, hepatomegaly. Pulmonary congestion. So left-sided heart failure commonly leads to pulmonary congestion, and because of that it can't pump blood effectively and causes fluid back into the lungs. Febrile. What does the term febrile refers to? Low blood pressure, rapid heartbeat, fever, shortness of breath. The answer is C, fever. The term febrile is also called fever, and it is one of the indication for infection and inflammation. So what is a febrile? Is nothing but elevated blood pressure. Okay, the next question, which condition is caused by butterfly rash on the face? Which condition causes or indicated by butterfly rashes on the face? Psoriasis, systemic lupus erythematosus, eczema, rosacea. B. Systemic lupus erythematosus. So butterfly rashes we can also caused by systemic lupus erythematosus, and it is an indication of autoimmune disease. Then which condition, which is the term for low oxygen levels in the blood? What is the term for low oxygen in the blood? This is also easy question to you. Hypoxemia, hypercapnia, hypocapnia, hyperemia. Answer is hypoxemia. low blood levels in the blood, and it is one of the indication for respiratory cardiovascular conditions. The next question: what is the primary purpose of Braden scale? Is the primary purpose of Braden scale to assess risk for pressure ulcers, to evaluate cognitive function, to measure pain intensity, to monitor blood glucose level. The answer is to assess risk for pressure ulcers. So Braden scale is a one type of tool used to check the pressure ulcers or bed sores based on factors like mobility, activity level, nutrition, sensory perception.